setting up cold laser or low-level laser therapy on various hand diagnoses. Also, a comment on what to do with tattoos. Now I'm going to show laser therapy on an area like a hand, and how do you deal with the fact that you can't keep the head on one area, so to protect the patient. So let's restart. We're going to go through laser. This Chattanooga has a pin. I'm going to go directly to the edit screen and choose a treatment of 70 seconds, which is the arthritis treatment generally. And now what I'm going to do is, the patient already has his glasses. I'm going to put my glasses on again so that my eyes are protected. I'm also going to hand this patient the kill switch, or we're going to call it stop switch. There you go. And if he doesn't feel safe, he can turn that off at any one point in time. I'm going to put this on the person, and I'm going to hit start again. Go on the screen right here so you can see the big warning that comes up. It says laser is armed and ready to go. Okay, now here we go. Onto the skin, and I push the button right here, and you can see the lights. Now, he said that he had some pain on his wrist, so what I do is I tend to encircle the area to make sure that I'm only working on that one area. Now I'm going to hit pause for a second and make a comment about tattoos. Tattoos, you have to be careful. Darker skin, darker pigmented skin, or tattoos, there is some caution that you need to use. Also, very dry skin, they say it's pretty hard on the body to have dry skin. There's some absorption of the laser that can cause the patient a little bit of discomfort, if not damage the tissue inside there. So I do not recommend doing any laser over the tattoo. I do also say maybe the person should put, make sure their skin has some moisturizer on it, but is not too oily. So again, I'm going to show how I'm going to do it, the wrist and the fingers. So I'm going to cover this whole area here to make sure it's protected. Again, the red is safe. It's just the LED. And you can see I'm encapsulating it. So if anything, my fingers are getting a little treatment. Now when I do fingers, I either have the fingers on a table and I'll do multiple fingers at a time, or I will do it on their lap so that basically their leg will get a little extra laser therapy. So you can see, you need to make sure to think about, how can I do this? If I was doing his thumb, I would probably put it into the hand, and in this case I wouldn't be able to really protect myself, so again I'd probably put it on his leg and then just encapsulate it so it just stays in one area. So you just have to think about, how do I handle this? If I was working with a carpal tunnel, which is probably one of the more common things I could do, it's pretty easy on most people, but some wrists are small. So we'll turn this on again, and I'll block that one part where it looked like it could escape. And again, you can turn it off when you're done. Another thing about laser, don't forget you can work with your Dupuytren's contractures. You can go right into the palm of the hand. You can maybe even combine it with some stretching, because this is the one where the contractor, the guy who makes furniture with the sander, has contractures in his hand, and I can actually go into the hand and do some stretching during the laser and hopefully make a little bit of a difference. If I had somebody who had that tenosynovitis right here in the hand, Desquer veins, if you will, I'm going to make sure I have my hand here so it doesn't spill out. And again, you can tell when it's on, and I'm just aiming it to where all the sore spots are. One comment about using cold laser, because you don't feel anything unless maybe the LEDs got a little bit warm. This is just a wee bit warm. They're not going to think anything's happening. You're going to be charging for a modality that they're not going to feel. So what I like to do is, let's say he had the Desquer veins, and that's where, if you have pain right here, you just have him do this Finkelstein's test, and it says, ow, that really hurts. And then you say, how bad? They say, oh, it's an 8 out of 10. You do your treatment, and then afterwards you ask him to test it one more time. And if there is a difference in numbers, your patient is now convinced. Now, if there isn't, you may need to do a couple treatments. If you don't see a big result within a week, I would say this is not exactly the best treatment.